Hi everybody, I'm Dr. Jordan Williams. Today's 3-minute injury report is about swimmer's shoulder, what it is, why it hurts, and what you can do to fix it. Is your idea of fun getting wrinkly in a pool with a bunch of people in the morning really early? Well, chances are you have swimmer's shoulder, or you have had swimmer's shoulder in the past. You could have swimmer's shoulder if you're training for the Olympics, your local triathlon, or you're just swimming with your master's group in the morning. So what is it and what can you do about it? Well, first, let's start with the anatomy of the shoulder. If we take a look at the shoulder, we have the clavicle, the sternum, or the breastbone here, and then also the shoulder blade. No ribs are here, and then the arm bone there. When you're swinging your arm up over the top, what happens is the rotator cuff muscles here are all working to get that arm moving. If we take a look at this on the side, this muscle here has to move through this little space like that. And then the arm comes down just like so. This muscle right here can get really pinched if your shoulder is forward. Swimming is much more of a forward motion, and so the muscles in the front actually get stronger. When that happens, you tend to rotate that shoulder forward more. When that's rotated forward, it closes down this space and actually rubs that shoulder muscle underneath that bone that's out here. When that happens, that's kind of like having a little bit of a scratch on your skin and you're just over and over scratching it over and over and over and over. It doesn't hurt at first, you might not even notice it, and then after a while it starts to get really painful. That's what swimmer's shoulder typically is caused by. So what can you do about it? Well, the first thing that you can do is kind of changing some of your biomechanics. When you're swimming, if you have a really forward shoulder and you're bringing this through, that's going to pinch that over and over again. So if you bring that shoulder back a little bit and get a bigger stroke there, that actually opens up that space and decreases that irritation, decreases that rubbing that happens in there. The second thing that you can do is just a super simple exercise. You're trying to open up this area, trying to stretch out the front part of your pecs, the front part of your chest, to allow those shoulder blades to come back. So when that happens, or one of the ways that you want to do that is to open up just like this, get big T shape, stretch out the front, and then come back. If you have a foam roller, you can lay it lengthwise down your back and lie on a table or lie on the ground and just let those arms stretch back and forth. You're trying to get this as much stretch as you can there. The last thing that you can do is called the wall angel. So you're good with swimming motions, you do the frog, you do the backstroke, you do the breaststroke. This is similar to think of it like a weird swimming motion. So you're gonna be up against the wall, hands, pinkies, and just leaning and trying to get as high and as low as you can each time. Trying to get all those muscles in here stretched out while these ones are working. If you do those 3 things, this will definitely decrease some of the pain in your shoulders while you're swimming. It's not going to decrease it right away, but definitely stick with it. If you do these things for a couple weeks and they help, we'd absolutely love to know about it. So drop us a comment below, give us a call, or shoot us an email. If you still feel like you're having some difficulty with it, it's a little bit painful still, we'd love to be able to get you back in the pool without pain. We'd love to be able to see you in the clinic. And we hope to see you soon.